we have, from the department's perspective, it is moving with even more strength forward on implementation. There's a lot to keep moving, despite the debates and despite the discussions and the efforts that we all have been reading and hearing a lot about. So I think that for us, the priority is in terms of how to respond to efforts to repeal. We're just every day moving forward and moving full force on this implementation. I'll also distinguish between repeal and the idea of revision. You all heard President Obama say the other day, and this is something we heard here pretty often since 2006. Let's fix what needs fixing, and then let's move forward. Anything that is identified, a strong theme I said already in implementation is flexibility for states and flexibility for the stakeholders who are affected by this law. Let's look at what proposals are for making changes or for fixing something, and let's work on that together. That is very much becoming an important priority too of the department. I will also say that priorities going forward, apart from any discussions about making any changes or changing funding to any provisions of the Affordable Care Act, it's important for us to keep in mind we can quantify what the benefits have been already. We can quantify what the benefits are to come. And that means we can quantify what would be lost if changes were made and if sections were changed or if funding was changed. Continuing to emphasize the priorities of the flexibility for states and innovation and technology and the investments and support of innovation and technology. Those are areas where you all are in the middle of informing and participating in those strengths of the Affordable Care Act. That's something we're continuing to prioritize. The new uses of technology and the creation of new technology really as part of a core element of transforming the healthcare system, which is really what we're undergoing right now. And I'll tell you really quickly a story. Recently, my 3-year-old daughter went to her wellness visit at a pediatrician, and within the next couple of weeks, she started, she had a shoebox of, little things that were her doctor's kit, like a wooden block, and a ribbon was her blood pressure cuff, and she took the dolls over to the table, and she had also her new toy laptop in her arm. And she went over to the table, and she opened her laptop, and she said, let's see how you're doing today. And she showed the laptop to her doll patients, just as her pediatrician had just shown her where she was on the growth chart. So make no mistake, technology is going to be a critical part of the future and a critical foundation and core element of our new healthcare system. And that's really it. I mean, I think that, bottom line, the response to efforts to repeal, we're moving forward even more strongly on implementation and what we know is the law and our responsibility and duty to implement it. And keeping the focus on what the most important provisions of a range of provisions in a very complicated and fast set of reforms.
So I would just say, to sort of follow up on what Christy just said, prior to my coming to Foley Hoag in March of '09, I was the general counsel of HHS during the Bush administration, and I was providing legal advice to CMS during the implementation of Part D. And I guess I would just say that I agree with what Christy just said. The healthcare reform law is 100 times bigger than Part D, but Part D was a major change in the American healthcare system, and there was a lot of partisanship and there were a lot of politics going on with Part D because of the way that it passed, just like there's partisanship and politics going on with the way healthcare reform passed. But as someone that was in the department, like Christy is now, as a political appointee, I really do agree with what she just said, which is you have to sort of divorce yourself from the politics and the noise that's out there, because it is the law of the land and it's got to be implemented. And there are many important provisions in that law that affect the American people, and as public servants, it was my responsibility and it is Christy's responsibility to implement that law. And so as hard as it is, And sometimes, as infuriating as it is to hear the politics and the noise, you just sort of have to put it aside and do your job and continue to put 10,000 miles on your car as you drive around New England.